Roll call, please.
Director Butler.
Here.
Director Winfield.
Here.
Director Garcia. Here. Director Fonte. Here. Director Burkett.
Here.
Director Valdez. Here.
Thank you. Now can everybody please stand for the pledge of allegiance? Ready? Again.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Now move on to consider approval of the agenda. In the case of an emergency, items may be added to the agenda by a majority vote of the board of directors. An emergency is defined as a work stoppage, a crippling disaster, or other activity that severely imperils public health, safety, or both. Items on the agenda may be taken out of sequential order as the priorities determined by the board of directors. The board may take action on any item appearing on the agenda. I have a motion to approve the agenda. I so move. I have a motion by Berker and a second by Valdez. All in favor, say aye. Aye. Any opposed? Any abstentions? Motion carries. Now move on to public comments. At this time, the board will hold comments on any agenda item. If any person wishes to be heard, they shall stand, address the president, identify themselves, and state the subject for comment. Time limit for each speaker is 3 minutes individually per item to address the board. Individuals who wish to speak on multiple items will be allowed 4 minutes in total. A total of 15 minutes shall be allocated for each item for all members of the public. The board may find it necessary to limit the total time allowable for all public comments on any agenda or on items not appearing on the agenda at any one meeting to 1 hour. If anybody here for public comments? Nope. Seeing none. We'll move on to item 7, items for discussion and or board action with the medical staff report. We have Dr. Independent.
Tonight is supposed to be Dr. Al-Sharif, who's going to take his place.
You're going to move that to the end then? Or, yeah, you can.
I'm going to table the item until after 7D.
Yeah. Okay. Do you have to make a motion for that?
No, I mean, we could have done that under approval of agenda, but you can, as long as the board agrees.
Is that okay? Okay. All right, now we'll move on to item B, discussion and action regarding future El Centro facility naming and branding. So.
I wonder.
This is
I can't
connected to it.
connect my computer.
Yeah,
You know,
no. I can
Let's
send it.
who can I email this to so they?
Yeah, we send to bryan@ivhd.iv-hd.org.
Okay.
So we should be able to pull her up.
We can- we'll come back.
It's you're set up, but over the last several weeks, we have been engaged with marketing and communications, and then we had sent our inbound email, and getting some potential names for PCXC. And Matt did a great job in terms of gathering all the information. He had kind of a short, it was a longer PowerPoint, but I told him keep it short, so we'll see some of the information that was provided to us by our staff and some of the recommendations, which I think the overwhelming majority felt that the name should be in. So I won't go as far. But, you know, that's their recommendations, my recommendation, and the recommendation of the in here. So, hope that guys are pleased with the endeavor.
It'll be there soon. While we're waiting for that, I can do a little bit of intro. Madam President, members of the board, my name is Matt Nielsen. I'm the marketing director and really pleased to present to you this evening. I'll come over to the microphone. For the request from our last meeting, we consulted with UC San Diego about their naming conventions, and their naming conventions are really quite simple. University of California, San Diego, and then add the geography. You can see that for clinics, you can see that for campuses, you can see that for hospitals. There are some exceptions. For example, if somebody gets a nice gift, they will name a building or a business unit after them, but it's really quite simple. They returned to us and they recommended, so take the first half, that we name El Centro Regional Medical Center, Imperial Valley Health, El Centro. And then they also recommended that we name Pioneers, Imperial Valley Health, Raleigh. And you're not going to see, if we go down that path, you'll only see one of those recommendations kind of made it through. I wonder if I sent this to the wrong address.
That's good to hear.
B Ryan, correct?
Yeah.
BRYAN.
At IV-HD.
I wonder if it's taking some time to get through. Maybe it got caught in the spam filter, maybe it's
Why don't you try sending it to me and I'll forward it over and get it that way.
and if you want to table me, come back to me to do that, or I can keep going here. Okay. We had 90 employees respond to our survey that we sent out. You also asked us to check with our employees. We asked them an open-ended question. Started off right with, what would you name the hospital? So it was very open-ended. We've received probably more than 100 recommendations. No, almost 100 recommendations. And some of the trends that we saw was people pointed out the names would be easy to remember for the elderly population, which kind of reawakens some of our marketing neurons. Sometimes we overthink this a little bit and we say to ourselves, no, that's great guidance from our employees who are on the front lines. They thought some of the ideas that we had around Imperial Valley Hospital or Valley United Hospital sounded bureaucratic, bland, generic, little more, a little louder. Oh. Sounds good. All right. Sounds good. So then they also said that the word united in Valley, they reminded us that maybe we weren't in the automobile sales business. So we took that quite seriously. Really, they gave us a lot of great ideas. A lot of people, we saw a lot of passion come through for creative, beautiful sounding names. Oh, there we go. Put out a couple more slides. And then Imperial Valley, because it brings together multiple communities, it already implies united, so that word united is not so necessary. The next slide, please. Yeah, this is the list of names. We're not gonna go through this, but people, yeah, that's quite the eye chart. But people had some really great solutions. A lot of people liked the simple. About 11% of respondents said, hey, just leave the name alone. So we move on to the next one? I see a lot of people looking at that. So the recommendations, Imperial Valley Health Central is the recommendation. Pioneers Memorial Hospital, no Delta. But let's run those parallel. Why? Go ahead, we can jump to the next slide. Simplicity, easy to remember, integrates Imperial Valley into the titles. We're gonna be able to use that pattern. We'll be able to use that pattern as we name clinics, as we name other entities. It also reminds the taxpayer that we're staying true to AB 19. But we do leave some things on the cutting room floor if we go down this path, though. Let's jump to the next slide. Let's be honest about this. We do leave behind the opportunity for a modern, kind of a pretty sounding name, a nice sounding name. We can't satisfy everybody. Boy, there were people who wrote kind of like little paragraphs of what they thought, and they had some great arguments. And I was like, I'm so glad people love being in this organization. And then we do lose some parity with Pioneers Memorial. We won't be sounding exactly the same. So we're returning back to that same. If we go back 2 more slides, we can come back to the recommendations.
There's a Imperial Valley Health dash El Centro Hospital, and then Imperial Valley Health dash Pioneers Memorial Hospital.
Actually, the recommendation is right now not with Imperial Valley Health dash Pioneers Memorial Hospital, but would be Imperial Valley Health with or without the dash of Centro.
Yeah, that was a hospital, just health center.
Yeah, and the agenda is only about the authentic facility, not about.
Yeah,
We did explore that later.
yeah.
But our recommendation is to bring that possibility to go about healthcare.
Well, it'll be our IVHD, Imperial Health Care, Imperial Valley Health Care District, Imperial Valley Health Care District. This by the IVHD Pioneers Memorial Hospital.
This is the GBA.
Oh, it would be a DPA. What we're seeing is that a lot of organizations, that their logo is saying enough about these organizations. The logo is speaking for the overall organization, and then the entity is being named individual. In Utah, even Intermountain Healthcare, their Intermountain Medical Center, kind of their flagship hospital, only says Intermountain Medical Center, and just has the logo sitting there. And logos speak, pictures are 1,000 words. They speak pretty loud.
Then how would you like? I mean, I'm just not getting it, because it's like, this is a hospital, but then you have all the rural clinics, because the rural clinics, even in Brawley, that are Pioneers Memorial, going to be Imperial Valley Healthcare District and all. Like, I assume take all those signs down, and it just says Imperial, but then it could be like the rural clinics.
Yeah.
Like.
Right,
some-
but that's where, so, what we're looking at doing here, sorry about that, Matt.
I think everything should be Imperial Valley Health. And then, like, name what it is.
Right, and that would be the end goal. So for example, Imperial Valley Health El Centro is for the hospital, then you do Imperial Valley Health, whatever clinic that is. Right now, we don't have, to Matt's point, like the way that it's set up with Pioneers Memorial Hospital, the issue that we run into at this point is we've already done all the changes and we've already made that it will slow down this process right now. It's something that can be done at a later time, but if we do it now, like we still have stuff in progress that's not finished yet, and we would have to start that all over again if we try to change the name of it to Imperial Valley Health Pioneers, for example.
Do marketing without changing the name.
We have to do the DBA. We have to,
Yeah, and so for the purposes of the merger and the immediate thing that we need to figure out what the DBA is going to be for the purposes of the license transfers for all the chows that are happening, because you can make different decisions down the line on all the naming stuff pretty easily. But for the purposes of the license, there's a lot of applications, Medicare, pharmacy, CDPH, that we have to turn in a lot of paperwork over the next 30 days. And actually, one of the filings will happen in probably the next 2 weeks. Where we're gonna have to indicate the DBA, and it's actually quite burdensome to change it down the line. So it would be nice to have that established here, and specifically what we need, because I'm looking at the license and I talked to our regulatory counsel about this, is the name, the DBA for the hospital and the 2 El Centro RHCs. The rural health clinics, the 2 El Centro ones, because those are the ones that we're gonna switch over under IVHD. So we need to know what the names should be on the applications for those. And in a perfect world, the board would decide that naming, and that's how it would stay, and it would be on the license, and it would also be on the building, right? But I don't want to overwhelm you with the breadth of a decision that could affect so many different things. So putting the Pioneer stuff aside, Pioneers and the Pioneers RHCs aside, because you can name those differently later, right? After the merger or next meeting or whatever you want. But for the purposes of today, it would be super helpful to have a decision on the DBA, and it's because the license is currently Imperial Valley Healthcare District, DBA Pioneers Memorial Hospital for the Pioneers facility. So we just need to know it's going to be the same license holder. So it's going to be Imperial Valley Healthcare District, DBA, what afterwards? And then is it going to be something different for the 2 rural health clinics? Or, like, are we going to go Imperial Valley Health, El Centro, Imperial Valley Health, Lexico, Imperial Valley Health, wherever the other RHC is.
Central Clinic, Lexico.
Yeah, El Centro, El Centro Clinic, and then Lexico Clinic, and those are the decision points, I think, for today.
Yeah, that's why I was asking. I was like, would it be Imperial Valley Health, El Centro Clinic, and then it just Imperial Valley, El Centro? Or what is it? Is it clinic? Is it
Yeah,
hospital?
you might
Is
wanna
it
say-
office? What is it?
That was kind of my hospital.
Yeah,
Well, it would be consistent with Pioneers Memorial Hospital if you had hospital in the name, but you could do whatever you want.
I myself, I actually went from Bill Valley Health to Central, Bill Valley Health,
yeah.
and then Bill Valley Healthcare Clinic. I like it like that, so I don't know.
Or like Lexico Clinic,
Is
clinic after.
healthcare
Yeah.
available or is it just taxation?
But if Bill Valley Health. I really think we were building a system.
Yes.
So if you look at all the hospitals in San Diego and in Sacramento, you have health care, and then this stuff like Rosemont, Shot Memorial, Birch. So this stuff, same thing with Scripps. You have Scripps Health, and then you have Scripps La Jolla, you have Scripps Green, you have Scripps Encinita. And you look at Sutter Health, it's the same way. The name Sutter Health, and then specifically the county where they provide the services. And that's what we're trying to get at with the name. It's that matter where you are, it's going to be a branding of the healthcare district. But it depends on your location where you are.
I like the idea of naming the location in essence for clarity for patients, right? So your next appointment is at this location. I mean, it's pretty clear where that's at. That's a plus.
Will adding that Imperial Valley Health or Central Hospital help or?
I mean, that's what I like, because then it's,
That's what it is.
that's what it is. Yeah, it's the hospital, right? Like same with, like, I'm thinking like branding, big picture, like probably mentioned, like Imperial Valley Health, Pioneers Hospital, right? Imperial Valley Health, El Centro Hospital, El Centro, that's kind of what I was
I like that.
thinking.
Because it's a hospital, because we have clinics as well. So-
We gotta remember, we have a language barrier, right, with people too, so. And all the other people.
Experience.
Yeah.
Location, graphic.
So you haven't got any questions. So.
If I may interject, also, I like that you're taking this and talking about the practical use on the front lines. I also think about how how a reporter is going to say they were taken to Imperial Valley Health Care, El Centro. So I did kind of cut out the care, so that's what I nudged us toward. Shorter can be better from the perspective of views of a frontline clinic person, explaining where the point is, a telephone conversation.
So Rodolfo, were you saying in Carroll Valley Health Central Hospital like that?
That's consistent, you know, you got PMH with the ECH, right? And then you could do DBA Imperial Valley Health dash Calexico Clinic. And then Imperial Valley Health dash El Centro Clinic.
Yeah.
Because those are the other two locations of the two El Centro, ECRMC, RHC.
You say, yeah, in the perfect world, it would be well.
But we're keeping our IVHD very good.
Yeah.
And all of this that we actually work hard on and we like.
Yeah, like when you look at the Pioneers
Yeah.
logo, it was, you know, the Pioneers one,
Yeah.
yeah, it's something similar.
Yeah, so to Matt's point, one of the things that we would be looking at is how we, when we get to that branding portion of it, it would be that IVHD would be that, yeah. Well, that would be the part, that branding part would be the same for all locations, whatever that branding is. It would be that, and then the location. So the branding would be the same for wherever, and that's the IVHD branding. So that would be the piece you'd have, and then Imperial Valley Health, El Central Hospital. And then same for the stuff in with Pioneers, which again, let's look at later. But that's the branding piece that would connect it all together.
If there are a few challenges with the logo, we may at some point come back and make a recommendation with the logo. But, that's for another meeting.
Yeah.
But in general, that logo, and the brand, yes, we can move forward with that very aggressively. There's a lot of work in there. It's well done.
I think that, we tabled this at a previous meeting and we had the opportunity for the workers, permanent staff to contribute to this discussion. And now we're incorporating their discussion and their ideas into what we're talking about. It wasn't just our idea, but I do like, Mr. Valdez's idea of Imperial Valley Health Central Hospital. I think that resonates, and to your point, you have a lot of Spanish speakers that only speak Spanish, and they're gonna refer to it as el Hospital y Centro, right? So it's gonna make sense. So,
Does that work for you, Matt?
What was that?
Does that work for you?
Yes, we need a motion and a vote, so let me propose a recommendation for a motion, if anyone wants to consider it. The motion would be to authorize the license applications or to authorize a DBA for the El Centro facilities in the following way. Imperial Valley Healthcare District DBA Imperial Valley Health dash El Centro Hospital for ECRMC, Imperial Valley Healthcare District DBA Imperial Valley Health dash Calexico Clinic for the Calexico Rural Health Clinic, Imperial Valley Healthcare District DBA Imperial Valley Health dash El Centro Clinic for the El Centro Rural Health Clinic. But that is the proposed slate.
I'll make the motion to approve just what you read here.
I'll second.
Okay.
Much to your surprise, James, I had a motion on good song.
I second that.
And then, and then the second by Berger. All in favor, by Berger, yes. All in favor, say aye.
Aye.
Any opposed? Any abstentions?
Congratulations.
Good job.
Since Dr. Alston is skipping, we'll have now.
Yes, I can introduce the next item if you want.
Okay, now,
So the next item on the agenda is interview of interested applicants for the vacant director position. Oh, I'm sorry. Yes, we're gonna take that. Sorry, go ahead. This is item 7A, the medical staff report.
Counselor?
Dr. LaFresh, you want to give the medical staff report?
Yes.
This is your item.
I'm sorry for being late, but by the way, the doors downstairs are locked.
Oh, no.
So I was stuck outside, just waiting for someone to take care of me.
Oh.
I'll go. I security. Okay, I'm sorry. If I put too quick or I miss to hear something, you know, but the medical staff of 5 years, our Imperial Health District had met on September 16. And there was a recommendation from the medical staff committee, membership and or privileges, policies and procedure as follows. The medical, the NEC, I don't think it's the law. The NEC upon the recommendation of the Presidential Committee of the President of Clinical Services on or achieve and based on the strategic prevention file, policies and procedure recommendation are recommended that the medical staff members and or clinical privileges be granted as outlined below. There was recommendation for initial appointment for professional staff effective October 1st, 2025, and there was recommendation for reappointment effective October 1st, 2025, and there was a recommendation for releasing of brokering effective also October 1st, 2025, and there was a recommendation for acceptance resignation from medical staff effective August 31, 2025. Additional timber privileges were recommended effective October 1st, 2025. And there was a recommendation of acceptance of policies and procedure form, which I outlined there. And item 11, the clinical services and committee were discussed. And the recommendation from the chiefs with those departments were all recommended for approval. The recommendation that the Imperial Valley Healthcare District Board of Directors approved each of the recommendation of the medical NEC for medical staff membership and clinical privileges as outlined above. Process and procedure as noted and authorized. The chief procedure officer to sign and document to the implement the state. If there's anything you want me to explain, let me know. Do
you have any questions from the board? Seeing none, we have a motion.
That's right.
I have a motion by Berger and a second by Proctor. All in favor, say aye.
Aye.
Any opposed? Any abstention? Motion carries. Thank you so much, Dr. Olson.
Thank you so much.
Now we'll move on to Anderson.
Thank you. Okay, so just a quick recap on the resolution that was passed at the last board meeting and the next agenda item, which is an interview of interested applicants for the vacant position. So, no, September 11th, this board approved the resolution declaring the vacancy and then approving the call for applications. The next day, the notice of vacancy was circulated to the county elections official, which is required by government code section 1780. So we sent that to the registrar, to the county registrar and county elections official right away. And we also posted immediately that same night on September 11th, the notice of vacancy and call for applications on our website and all locations. I also contacted the Quechan Tribal Office on Friday, the Friday after our board meeting, and asked for information on who to send the notice of vacancy and call for applications to in order to ensure it would be circulated throughout the tribe. They gave me the email address for the tribal secretary. So the following Monday, September 15th, I emailed the tribal secretary and I attached the notice of vacancy and call for applications and explained that it was important to this board that the notice of vacancy and call for applications be circulated through the tribe in whatever way they thought would be best through their community. So that was all done. The call for applications, which board approved at the last board meeting, set a cutoff date of last Friday, September 25th at 5 p.m. So over the next couple of weeks, we got 9, I believe, applications. 8 applications. We did get one late application that came in over the weekend. And I responded to that individual and let them know that I didn't have the authority to allow a late application, but that this was a public meeting. They could show up if they wanted to and ask the board or give public comment about their request for a submission. And but I, wanted to make sure and honor the folks that got their application submissions in on time. So those are the folks that you see on the candidate list. Now, since publishing the interview candidate list and circulating the applications to the board, which I did last Friday, we've had 3 folks withdraw. So Natalie Erickson has withdrawn, Guillermo Hermosillo has withdrawn, and David Dillon didn't necessarily withdraw, but he's the person that was supposed to attend via Teams. And he called me earlier today and he emailed me tonight, letting me know that he had a prior conflict for many months. He had a speaking engagement tonight. And originally asked to appear via video conference. I said that was fine, he could appear via Teams, and I slated him for the last slot of the night. But earlier today and in his email, he said he didn't think it was gonna work out because it's like one of those events where it's a dinner and then they're schmoozing and then he gives a speech and he didn't know exactly when the speech was gonna be. And then after the speech, sometimes there's Q&A, and he thought he might go on around 7:30. So he was like, I don't want to not show up and being disrespectful to the board. And I also don't want to, make myself look bad by being late, etc. So while he was very interested in the position, he sort of withdrew because he can't make it, but then also sort of said, if the board doesn't select someone tonight, to let him know so that he could sort of reapply if the board wanted to reapply, or wanted to reopen the candidacy window. So with that in mind, we have this slate of Dr. Carlos Ramirez, Dr. Marvat Minera Calada, Matthew Cowie, Ramon Castro, and Felipe Irigoyen. And they've got their time slots here. We're behind, but I do recommend moving forward with the interview. In terms of an interview cadence, my recommendation is just call folks up, have them introduce themselves, have them explain, who they are and why they're interested in this position. And then it's a Q&A. You're welcome to ask any questions that you'd like. And if you have questions for me, I'm here to help. But it's really your interview, and I slated 15 minutes per applicant. You can go longer, you can go shorter. It's completely at your discretion. So I'll call the first candidate up, and that's Dr. Carlos Ramirez. Thank you for your patience, Dr. Ramirez. And and everyone in the audience.
Good evening.
Hi,
Good evening.
can you please tell us about yourself and why you're interested in the position?
Sure. I believe before you have my resume, my name is Dr. Carlos Ramirez. I'm a doctor in health administration, registered nurse, nurse practitioner student. I should be done in a few more months. And I became a nurse in 1995. I'm a former employee from the Central Regional. I spent 10 years of my career here. I have also worked at Pioneer. In the Central, I started from the bottom as a, emergency department technician, LVN, RN, manager, director of critical care, and then at Pioneers, I went as a registered nurse in the intensive care unit and eventually managing the unit. I also have done home health, hospice, with different companies in the Imperial Valley. I've been a nurse professor for IVHD for 8 years. I had to resign because I had a big administrative job with one of the companies in home health. I was the regional director of operations for 14 years. And then I worked for another agency. I became the chief nursing officer and chief operational officer for the home health agency and hospice. And the last 4 years of my career, I've been an independent contractor. I have my own company, Dr. Ramirez Consulting, which I work for different practices here in the valley, different physicians, clinics, home health agencies, doing consulting, marketing, strategy. I've had a lot of training with corporate management with one of my companies, so I'm applying that whatever I did in school. Also, I'm the owner of a local assisted living facility, compassionate senior care assisted living. It's a social facility here in Central. And I'm a full-time dad, husband, and that's pretty much about me in a nutshell. The reason why I'm interested in this position, when I worked in the center for 10 years, it was my first job in healthcare, so I was really excited and was able to, with hard work, being promoted to different roles. One of the years I got actually the Shining Nurse Award in the center, that's voted by your peers, by my peers. I remember the first time I came to a board meeting in El Centro, me and 3 fellow nurses. That was before the internet, but year 96, 97. We were requesting higher salaries. We were getting very low. I think it was like $18 an hour for a registered nurse. And we knew, because there was no internet, looking at newspapers and magazines that El Pisandeiro was paying like $28, $30 an hour. So we spoke to the CNO back then, and she listened to us and she told, have a plan, do a presentation. So we came to the board, presented our case, and we did it very democratically and diplomatically done. And the motion was passed to increase the salary for the nurses. So that was one of my first fighting for what's right, for employees in the center, that we did the right way. I haven't done that, I'm a commissioner for the local health authority. I'm a board member for the CHPIB. I'm the chairman of the finance committee. I also have been working with Dancing for a Dream for several years, for TMP cancer. Some of this trying to involve myself in the community, not only as a nurse, but also as a give back to a community that has done so much for me. I'm an immigrant from Mexico. I came when I was 15 years old, didn't know how to speak English. I learned. I graduated from IBC. So I've been able to give back to the college that helped me become a nurse, and also to continue giving back to the community as a nurse. I go also do motivational speeches. I've done University of Delaware in LA. I've done commencement speeches for University of Phoenix in San Diego, Los Angeles. So I always trying to promote nursing, to promote healthcare, telling young kids that being a nurse is amazing because we need so many. There's 1 million nurses short in the United States. So being part of a board like this, I think is just the next step for me to be able to continue applying my passion, the care that I have for this community. I believe I'm a very good candidate because I've been a patient here, I've been a nurse, I've been an administrator in both hospitals, in all of the outside community, also outside healthcare systems and departments. I also have done some work in San Diego, and I think I bring a lot of value to this community because I've been in all the different areas that you may think, and my expertise are pretty wide in any area, from patient to educator to administrator to hands-on bedside nurse. And that's what I'm here today.
So I have a question. So I have a question. So as CEO, you're really, as you're talking about in your experience, you're really involved in day-to-day operations, implementing, different managing day-to-day. And so, but as a board member, your goal would shift to governance. Can you give me, kind of what your plan would be to distinct between the two? So your, formal background training is involved in day-to-day, but as a board member, you're not being day-to-day. Can you tell me?
Yeah, well,
Why
I'm
you do
I guess, I'm in the steering committee without aim, and also with the CHPID or local health authority. So that's kind of the same procedures that you guys have. I'm pretty used to, and some of the members here also are in those committees. So I understand the difference between this is not my show. It has to be in a democratic way. What would I do when I disagree, let's say, with the motion that the board is really pushing for? I think the best communication and explaining with data and with evidence-based practice of why I believe I'm gonna be the best choice, or why I think that the other way to see things. I've done the same practice in the committees that I belong to, in the boards, and sometimes, like for example, with CHPIB, I'm the only non-physician commissioner. And I think that makes a different perspective, because we have doctors, we have also the CEO of the hospital. So I always feel that my background and information that I bring sometimes helps to create a discussion or guide it in a different way. And always, again, I will be always reporting whatever the majority of the board decides to move forward. I hope that answers the question.
I have a question. What do you see as the most significant challenge or opportunity facing the hospital in this?
Well, the first thing is the sustainability. I think that will be the first thing to make sure that the merge works well, and what can we do as a board to make sure that happens. Since I was a baby nurse, I mean, the nursing shortage has been an issue. It's been getting worse and worse after the pandemic, and with the baby boomer generation retiring and not replacing and passing up, that will be another thing that affects this hospital and many other hospitals that I have been to. And also the community view of our hospital. It always hurt me when I was, working for the city. It still hurts me when I'm not, when I was employee here, that you will go out to the community and people see you, oh, you're working on Sandra, oh my God, you guys, you're just trying to shop something at once. So to me, it's what can we do to improve and that image that we have in the community? It really hurts me when I see, rants and raves, things like that. Oh, I had this horrible thing. But I worked here before, and I know there's very good nurses and doctors and people that teach their own, with the heart. But unfortunately, one bad episode with somebody creates there's a formula for that if somebody has a bad customer service, they will tell 50 people something like that. And when somebody has good experience, they don't tell anyone. So what can we do? I would also, work with the board to, what can we do to open forums for the community to talk to us, to be more reachable to them, to have make committees that we can let them express their concerns, their ideas, and I think that's the best way to win their trust again, to be transparent and telling them why we're working so hard. It would be like my 3 challenges that I see that are coming in the next 2 years.
So would you do that as a board member, or would you direct staff to do that?
I think it's a combination. Sometimes as a board member, you cannot be in every single event out there, but I think also being part of the community outreach is, I think, is part of the of a board member. I mean, I will have to see the bylaws and the job description per se, or what can we do, we can do. Obviously, I need to be very familiar with that before knowing what the boundaries are. But as a board member, I've never been afraid of being in the community and talking to people in a respectful way. I've done that with other boards that I have belonged to. So I think, again, that's what makes a difference. When the community sees just somebody they can talk to, reach out, versus somebody out there that there's no way that you can get close to that person to give them an ear to listen. Part of good leadership is also to know how to listen and have the time to.
What are your concerns about joining the board?
No, if I have considered anything, I would apply. I think is something that I felt it was a good opportunity for me to apply and let you know who I am. I have a very long history with the Bear Valley in healthcare, in education, and I feel it's good for me to introduce myself to you guys and also let you ask questions, but I know most of the board members in one way or another. I have worked with some of them in the past with Mr. Ricken, with Mr. Garcia, with Flores together, with Mr. Berker. Who else do I know here? I mean, Pablo, I mean, I think in the different committees and boards that I'm always surrounded by healthcare experts and healthcare providers. And so I feel the board is another place where I would fit, we fit well. Thank you.
I'm reading your resume and basically based on what you just told us, you have a lot of connections within the healthcare industry. And of course, one of the things that is kind of concerning to me, and I would like to know if you have any conflicts of interest, because obviously if you stand to gain financially by anything decisions being made on this board, you would have to recuse yourself. You could not be part of the discussion in any way, shape, or form because you would have that conflict. If you yourself have a contract with any one of our facilities, that contract would be null and void. We cannot enter into a contract with you. So my question is because I would like to have a fully functioning board, not one where people have to recuse themselves. Do you have any conflicts of interest that you can think of or potential conflicts of interest that would cause us some concern?
Great question, and we are pleased no conflict. I kind of looked that up first too. And we did the same practice, especially, I mean, we all work with everybody in healthcare, right? So in other words, with the CHPID, we have pioneers in El Centro representatives. We have physicians. I have colleagues, because I've been in the industry for 28 years. But no conflict as far as any conflict with any hospital putting in for, if there was one, for example, something issue for if one of my home health clients, for example, I will have to use for that specific, if there was a fault or something. On the other hand, also I think my knowledge and experience with it also explain why this is important. If I can give an example, we were discussing for CHPRD for a vote on assisting pioneers when El Centro gave up the base hospital. And the CEO of the pioneers came asking for some support to restart it at pioneers, but they were taking over the base hospital. So my partner, because I was in MIT when I was in El Centro, we worked at the hospital for many years. The vote wasn't going the way I guess they were hoping, but when I explained to them the importance of having EMS services and having a base hospital, if somebody coming from Manila or Portillo, that's not be a 30-minute drive. And if you don't have a paramedic that can get, orders from the hospital quickly, that could be a difference of lives for them. So that's the background and experience that I mean. I think it's important. After hearing that, I think most of the board members understood, this is important. They're asking for something that is a life-saving situation in many cases, and that's how I feel about the background that I have. But at this point, I have not a single conflict of interest with any of the entities that I may be involved in.
I just want to ask one question piggybacking off of Ms. Goodell's question, because on the legal perspective with respect to conflicts, does any of the work that you presently do, could it be considered competition for Pioneers or El Centro or any of our clinics?
No, not at all.
I have one last question. Should you not be successful in your interview, are you going to run for election for the position?
Oh, good question.
Good question. Probably.
What district do you live in?
That's the question.
Can you tell us what district you live in? Okay, but what's your address so we can look up what?
You don't have to tell me your address, but I can show you the map. Because the elected official who runs for this seat that you would be appointed for in November of 26 would come from District 7, which is this pink area here.
I'm next to Southwood High School.
Why don't you come and just have a look, because I can plug in your address, but it's not, it doesn't have to be, but This is 7, all this pink stuff. So, I don't know, if you're in El Centro.
Yes.
And you just too.
Yeah, El Centro is largely 5, but I don't know how far.
Well, I'm next to Southwood High School, La Brucherie, and Ocotillo.
Wait, I'm so sorry. Uh,
James, can you help me find Southwest? And then Carlos, can you say what services you provide as a consultant?
Yeah.
Because you can.
Oh, okay. So my service as a consultant, I have worked with different physicians, and my contracts are usually 6 months, maybe a year. It's on, most of the local physicians don't have a good corporate mindset. And I teach them about, HR, management, corporate management, leadership, staff retention, recruitment, marketing. I help a lot with adopting of policies and procedures, best practices, teaching a lot of managers how to manage, many that people are provided without really training or education. So that's when I step in to help, especially places that are having a lot of employee turnover. That's when I come in to stop the bleeding and help hire quality staff, hire, give education to a lot of trainings and education that I do on service excellence.
So, Dr. Ramirez was in District 3, so you know. Yeah, so you can appoint from anywhere in the county, but the election will be for District 7.
We will also do that.
Yes, also, we'll,
Yeah.
3, yes, 3 will be up,
1, 2, 1, 2.
1, 2, and 3 will be up in 26, 100%, yeah.
Can you explain what your understanding of the difference between a board member and a CEO and staff member is?
For board member, and you're talking about the CEO for the hospital, for the health district, or CEO anywhere?
No, here, when it as it pertains to IVHD. The difference between being a board member and being a staff member.
So a board member, we oversee the function and of the CEO. We are the body that will, like you were discussing earlier, naming the name of the hospital. You go through your staff to do the gathering of the data, bring it, present it to the board, and make motions on top of that. But nobody works for the hospital. No, it's a what's the word that I'm trying to look for? Non-biased, non-conflict of interest group of representatives to represent the community that we serve and to together as a team make the best decisions for the future of the hospital, being financial, being staff, being new therapies, new services that we're trying to provide. The CEO, not that they work for the board, but I mean, they report to them.
Okay, thank you. Does anybody else have any questions?
That timer was my 15-minute timer, just so you know.
Thank you. Thank you.
Thank you.
Okay, the next official, I'm sorry, the next candidate is Dr. Collada.
Everyone, do you hear me?
Yes.
So I came to the community since 1992. I have been a physician in the community since then. I finished my medical school with a program with UCLA, and then went to family medicine first, pathology, and then directed my urgent care in Mexico. And at the same time, I was with the hospital as a liaison physician elected on behalf of the doctor as a board member from 1995 till 2008. From 2000 to 2013, I worked for the medical board of California as a medical consultant. I also was a joint professor from UCSD from 1995 till 2000 to 2015. was an adjunct clinical instructor because UCSD have decided to send us into clinical instructor. In the meantime, I was involved in actually bringing the rural clinic in the area since I learned about them from my residency program. So I took Mr. Fox and we went to the state with Mendoza and we drove the first rural clinic, which was Central, the one that you see on Main Street, was on Imperial Avenue. And at the same time, I was with the hospital and was from 45 beds, typically between 165 beds, involved with the state. I had so many contacts with the state licensing department, just helping to bring the hospital into what you're doing right now. From a small hospital, 45 beds to 165 beds. At those days, we have only, we didn't have hospitals. We are the ones that just kind of like scrubbed in, did surgery, did everything on our patients from A to Z. So we were me and Dr. Nakamura, mainly the one in the emergency room, day and night, taking care of patients. And frankly, we were not paid those days. We were doing it just in having our practice and just being there for our patients. And afterwards, I continued with my clinics. I had another clinic in Imperial. I had to close it because of coronavirus. But I continued in my practice in Imperial and Mexico. And I, like I mentioned, I do feel like you did a very good job. I've been watching most of the meetings. And of course, Central and Wally have took a lot of me in my work, in my days, sleeping in the hospital day and night, taking care of patients. And of course, I just have been observing everything just to make sure as a community member and a local physician, I've been here for a long time, that everything is in the right direction. Just wanted to thank you for all the work that you have been doing, because we come from a different background, but at the same time, you did go through the right path, the way I see it. You just have very little tact to accomplish what you have. In short, what is needed and how can I help you is the following. One, I have a lot of contacts, whether they are medical contacts. Second, through the state licensing. And like Mr. Garcia, when we started the progress, I sent the staff. All we needed to do is the AV application, extend the district of Pioneer, and that will be easier to get the progress. I want you today of choosing the name. And honestly, we did a very good job of choosing the name because knowing a lot about rural clinic, the best thing to get away with it is really do the TPA. That's the right thing to go through it, licensing wise. Definitely, you might have issues with passing the license into the proper pass, but the whole job is done. I also wanted to bring to your attention, I did say that yesterday in our doctors' meetings with Dr. Dennis and Chris, it is so easy to get a lot of programs while everybody have consultation. Look at the clinic at the Salur in our care from a small clinic. We managed to build so many things that we can do, which has to do with a lot of programs are available for you guys that you can do. We have a lot of patients who are just a heart failure, pulmonary fibrosis, step down programs to benefit the hospitals in their progress that it can just go along with it. The question is why I'm just thinking that to think about this position. Honestly, because I care for the community. I work so hard in those hospitals. And I don't want them to go the wrong direction. And since I know that I can help, so I said, let me try. But if it is not something you feel like, at least we need to try to help the community. And at least I need to try to represent my physician doctors in order for them to go progress, to have the communication between the board and the doctors. I forgot to mention a lot of things about me. I'm also the chief medical officer for the Imperial County Physician Medical Group. Many things on my resume, numerous things that I just don't need to say, but like I served in many communities of Central Hospital and pioneers, for many years. With the utilization review, with the passing the hospital through JCO licensing, you could imagine how those things to bring a 40-bed hospital into 165. It was a lot of work. It was a lot of work from 1995 until I believe 2008, till the hotel was finished. And the other issue, why I think that I might just make a difference, because I do know a lot of programs. I have the knowledge because I work for the medical board. They have so many connections with this licensing. I have worked for the hospital as a liaison for physicians. So I developed my contacts with them. The other issue, aside from my care about the community, and aside from just kind of like the connection between me and doctors, which is something, it's just something I see it might help. That's all.
Can you explain to me what your interpretation of the role of the board member is?
Oh, of course, because I was on it for 13 years, yeah. The board basically oversees the entire operation of the hospital. Oversee the physician report that you saw today, oversee what's happening with financial situation, like how's the hospital doing, the financial report that comes to the board. Each time we have to make a decision. What are the things or the situation with the state? If they have certain things that you have to move forward in your position right now, you have a lot of things you have to oversee. Like you have a lot of issues that you have to deal with bringing the licensing into a farm. Which yesterday, when we got the report from Chris and Dr. Bailey's, we were informed that a lot of that has been done, but it should be hopefully by January. So I'm informed and I attend all the meetings, which is basically doctors liaison and the hospital CEOs. Okay. Any other question?
I have a question.
Yes, sir.
You mentioned in the resume that your clinic that created program for elderly and financial education and persons throughout the unit.
Yes.
Can you give us an example of what those?
Oh, yes. I do take care of a lot of folks. A lot of doctors don't care to take care of, but I'm glad to take care of. And you could, like when I used to get the calls for El Centro Hospital, I was known as a doctor for the people who have no insurance. I'm so glad to take care of them. Because the patient who doesn't have money has a family who has money. That's the philosophy. But not only that, the patient who doesn't have money, you 3 times the blessing. You know, when I came here, I was a very small doctor. I'm considered blessed, very blessed.
Anybody else have any questions? You do, Lauren?
Thank you. And my question would be the same question that I had previously because of your resume, because of your connection to those hospitals. Are there any conflicts of interest that would cause you to have to recuse yourself so that, you know, because if you have any financial gain that comes from your connections,
Well,
then you would have to recuse yourself and not even participate within the discussions. And then this board would not be able to contract with you in any, you know, in any of your facilities, you would not be able to have a contract with this board.
I would say that I leased to Pioneer, but not me, my partnership. You know, this is the Pioneer, and I'm an honest person, so Pioneer is my client, you know. But this is a partnership and should not recluse or like should not. It be like there is a special form that you sign in case something that you have to be in conflict, but honestly, not really, you know, because I'm here since I came to help the hospitals. Like the hospitals around me, I took the CEO to get the rural clinic myself, you know. As a matter of fact, I advised the Pioneer before they went to do the move to like a central bed with a clinic from Imperial to the one on 4th Street, not to do the move because this way we lost a lot of revenues, you know. So no, the two hospitals, I don't see any conflict of interest. I'm not paid by any one of them. I just like send my patients there. But honestly, since I came here, I don't remember us being paid even for those phone calls that we used to have in those old days. They didn't pay us.
Can we get legal to weigh in? Because even though it's not you personally, it is your LLC that we rent the Calexico Clinic from, so that you do get financial gain from that. So I want legal to weigh in on that.
Legally, it is a conflict of interest, in the eyes of the law, just because of the partnership and the barometer for material financial interest would be met here. So, Dr. Kawada would have to recuse herself from any discussion, action, anything in any realm under the Political Reform Act having to do with that location. And then the board would be precluded through Government Code 1090 from any amendment, future contract or lease or issue. So it would not be something that she could recuse herself from. It would be void on the DOA, dead on action. And then the other sort of legal concern I would have about conflicts would be about the competition aspect, because as I understand it, sitting here 500-foot view, it does look like competition for the facilities. So there would be that perception of conflict, even if there's not true conflict, it would be the, you know, potential perception for conflict from the public. So
Would you like to add to your comments? Actually, I'm the biggest referral doctor.
that's a conflict too. Yeah, yes, that's a conflict.
I'm referring to your clinic to all central. Others are not doing that referral, but I'm just trying to help both clinics, whether it's El Central or Raleigh, because it's convenient for my patients to be there. I'm the only one, actually, a lot of other groups, I'm not gonna mention groups, you know, people send lab or x-ray to each CRMC in front of me, and I have been sustaining them, frankly, just to keep me running. because my kids leave them. So I'm not sure. I do agree about the part with the lease, but the other part, I don't know.
No, it's, I don't know the specifics either. I would just caution you and the board, because truly on the conflict side, all the risk lies with the individual. Like all the criminal, civil fines, penalties lies with the individual and not as much the board. But on the 1090 side, you would be precluded from contracting. And then can I just ask what, district you live in, since that was a question?
I'm sorry, like my driver license say, Calexico, I didn't change it, but I really live in Sealy, but the legal address for the house is Imperial, which is on. So
So,
I have a house in El Centro, so I live in El Centro, Imperial, and Calexico office.
The registered, where are you a registered voter for? Like what?
Alex,
Okay, great. That's either District 2 or District 7. just so you know.
okay, thank you on that, because on your resume, there's 3 different addresses. Does anybody else have any questions for Dr.
my
Brown?
driver license is in Calexico, I decided not to change it.
No problem. Thank you.
Thank
Thank
you.
you. And again, I really thank you for all the time. Thank you.
Okay, the next applicant is Mr. Cowie. Did I say that right? Is it Cowie? Okay.
Good evening. Good evening, board. My name is Matthew Powell, and I'm a doctor. My day job, I'm the broker, co-owner of Princeton Associates Realtors here out in Alpharetta. I am in District 2. We're asking about that. I've dedicated much of my life out here, coming up on 20 years, to giving back to the community that has been very good to Whiteland. And with that, I think healthcare in the Imperial Valley is a very needed item, and I'd love to be a part of this board to see that into fruition. Access for our residents for healthcare. I don't see anything greater than that need. What I can bring to this board is 2 decades of board experience. I have 2-time past president of the Imperial County Association of Realtors. I currently sit as a director with the Sheriff's Activities League. I am a member of the El Centro Library Community and Services Board, secretary for the Los Vigilantes, and you'll see me out and about for pretty much everything chamber related, giving back again to the community that's been there. Well, I do have knowledge and experience with budgets, with managing, with overseeing, and working with colleagues on boards, navigating complexities of issues that come up within boards and within the community itself, and different organizations that I understand. So this is something a little bit different for me. I do have some medical knowledge. I wasn't PMT back in my former days. So I do understand some things. I do have family members and friends that are in the medical field. People conflicts with benefits, no one really able to do anything. But again, I'm excited, something different, and I think what I can bring is a non-biased approach to this field. To truly not micromanage anyone, but actually to work in collaboration with. I think that's where my strengths go. I think for students. Any questions? Yes.
How do you approach conflict resolution along with the different communities? I'm not working.
Yeah, conflict, I think would be a good thing. It's a good thing to have conflict but to manage it well. So I think good banter within a board is actually a good thing. It brings out good ideas. It brings out possibly different sides that one person may have not seen. In a healthy manner, I think that's actually very good for a board to work cohesively to come to a good outcome.
A question. What values or personal characteristics do you believe board members must possess to be successful?
Honesty, I think honesty, true caring of your position, see board members, again, not to micromanage or to have their own set agenda, and to really see the big picture of the company, to me, was pretty important.
What is your understanding of, pregnancy sector?
So I see it, really as, obviously merging with, the hospitals, to put healthcare first. I like to see, outreach to some of our communities that may not have access to the healthcare, whether it's telemedicine, and outreach to people that can't, get into, the services for the hospital. But also financially, stability of the hospitals for the merger.
What unique perspective or experience do you bring to this board for the community's need for this reduction?
I'm sorry.
What unique, what unique perspective or experience do you bring that reflects the needs of our community?
I think I just have a beat on the Imperial Valley bill. Like I said, I serve on a bunch of different communities that have totally different organizations that kind of see the big picture of it all. They're all vastly different, but in whole, they all have the same commonality of goal of making the valley a better place to live. I love this place. Again, did my home. I'm originally born and raised from Los Angeles. I wouldn't leave this place in a heartbeat. I love El Centro. I love the Imperial Valley. And I love getting back to being a community guy.
Answer my question.
Thank you, other question?
Okay, so.
Thank you guys for the opportunity.
Thank you.
Thank you.
All right, taking the time. The next candidate is, Mr. Ramon Castro.
Good evening, Madam President, members of the board, staff, members of the community, that's good here. I voted for statement that way I don't get long-winded, I have a tendency to do that. So I've had the privilege of serving our community in many roles, Roy City Council and Mayor in 2024, Roy Plan Commission, Imperial County Veterans Advisory Committee, and several nonprofit boards and other committees and commissions across the county. Each of these experiences has deepened my connection to the Imperial Valley and strengthened my ability to work with residents, civic leaders, and organizations across the region. More importantly, it has given me the tools to communicate clearly with our community, build trust, and to help rally support around the important work of our institutions. In addition to public service, I own and operate a couple of small businesses here in Imperial County. That experience has given me a practical perspective of managing budgets, meeting deadlines, and maintaining accountability. Skill that I consider essential for responsible board governance. Reliability is another value that I take seriously. If appointed, I will make it a priority to attend all meetings, be fully prepared, and remain available for special events or urgent matters. I want to be a dependable and engaged member of this board throughout the term of this appointment. I also want to acknowledge I understand this appointment is temporary. I have no intention of running for the great position on this board. I focus solely on providing stability, continuity, and steady leadership during this transition without any conflicts of interest. As a veteran, I understand the importance of discipline, accountability, and service to others. Healthcare is one of the most critical challenges facing the Imperial Valley, and I want to contribute to ensuring that families in our region have access to high quality care they deserve. And as someone who has worked closely with the public in many capacities, I also understand how important it will be to communicate the mission of this district and strengthen community confidence, especially with critical decisions ahead that will determine long-term stability and funding of this district. I believe I can play a valuable role in helping to bridge the work of this board with the people we serve. And we're not strict a little bit. We want to commend you guys on all of the work that you've done. I've been involved since I was on council, and prior to that, assembly member in Garcia. And we knew what a huge undertaking this would be. And honestly, I was a bit worried to see all the mandates coming down from the state, but you guys have done an excellent job. But I do believe that the most difficult step, the biggest struggle to move forward is coming up, putting a ballot to be looked through by voters is, it's different. And I managed to do that last year. The city of Raleigh is, very important to us. It might hurt me a bit, this is like no longer on the city council of the city of Raleigh, but we were able to get that done. And I'm very proud of my work, as the leader and as a member of the city council of the city of Raleigh. Thank you for your time and consideration. It would be an honor to serve alongside you, and I am committed to bringing my experience, reliability, and dedication to the work of this.
You know what district you live in?
District 1.
District 1?
You just indicated you weren't planning on running.
Too close. Try not to bounce that. I've been kind of in my cave for 10 months, and I was in council, a little nervous, to be honest with you.
Does the board have any questions for him?
I kind of, I weighed what I would ask as a board member, considering what this term means. It's 1 year. What are the duties of the person appointed to it? I understand that your job was, as a county member of this board, and state law that you need to follow. And this is for 1 year. I have no political ambitions as far as this board goes. I'm not gonna say others, because you never know. As of now, I don't have any other political ambitions, but I did see the need, and I saw that final step. That final step is honestly the most difficult, I believe. This requires a full voter approval, making that connection with the community, selling the needs of this district, right? And that the folks out there understand it. That's difficult. It's a difficult conversation to tell folks, hey, we want some of your money. But it's important because I think that this district, somebody asked a question about what I think IVHD is. What is doing for the community? I think it's saving healthcare in Imperial County. We know where both hospitals are going, and we know the quality of care that was offered besides that. IVHD is saving healthcare in Imperial County, not just saving it. I think once you combine resources and efforts, the quality of care would also, improve. So.
Thank you.
No, thank you for your time, and again, I appreciate the opportunity to be with you.
Well, we're officially back on track. It's about 7:27 and 7:30 is our start time for Mr. Felipe Irigoyen.
Yep.
Did I say that right? Okay, hello, Mr. Irigoyen, go ahead.
I'm good evening, guys. How are you? Good. Thanks for the opportunity. Appreciate it very much. I've been in the Valley since I was 4 years old. My parents were both immigrants from Spain. So we came down to the Valley with nothing, and the Valley has enabled us to develop a business from scratch and seeing our dreams and our ambitions come to fruition. So my feeling with the Valley is that because of what the Valley's done for me, for my family, I feel like it's my turn to give back to the Valley. As you'll see from my resume, I have a skill set that's basically business oriented. I've done a lot of startups from scratch, so I can understand how difficult it can be to raise funds, how difficult it is to find the right people, the right staff in order to be able to develop a business. And so I feel I have an opportunity to be able to help this board with the necessary things that need to be done in the future. So I think, congratulations that El Centro's coming into the fold now. But I also feel strongly that there's going to be a lot of work in the next year and a half, that's going to have to be done in order to have this thing merged. Any questions?
Do you know what district you live in?
Or
I do have a question. What traits do you possess, both personally and professionally, that you believe will benefit IVHD?
I have a very good work ethic. Also I have, very honest. And I'm a very good communicator, and I always like to see different sides of the coin. Because I want to be able to understand everybody's issues. And when we come to, a consensus, then we move forward. My background from, having to go and see people, cold calling people, basically, never met people, having to meet them and try to get business from them. I think that helps me, gives me a lot of thick skin. Where someone says no to me, I just go to the next person. So that's. Economic.
I know, I think everybody heard all the questions we asked, so. Yeah.
Yeah, no, yeah. And I've been through a lot of scenarios, and the other thing too, it's not always rosy. I mean, there'll be times where you're just gonna look at yourself and go, what am I doing? Or why is this not happening? But, I always believe that when one door closes, another opens. We just have to be a team what's going on.
I got a question. So I was looking at your resume, you've done work abroad with one of the several companies.
Yes.
How do you see IVHD compared to the work that you've done? How are you bringing that to IVHD? Because there, your profit is money. Here, profit is something different altogether.
Money is the result of a successful company. How I always look at companies is, I always look at the challenge of what it is to develop it. And, I gain a lot of, joy in order to develop something and have people working for me that are happy with what they're doing. One thing I like about this board is there's a diverse amount of different people on the board. And I believe that you guys have done a lot of work in a short period of time. So, some boards are large, some boards, don't really move quickly. But I like this board, it moves, and that's how I am.
I just, for, sorry.
Right under
For clarification, I mean, we were in school together, so I know totally, we.
A
We're
few-
not
a few
finding
years, a few
together.
years.
We won't say how many, so, but I do have a question, 'cause I know he doesn't have any conflicts as far as his business or any of that, but it looks like he was just appointed to LAFCO in 2025. Would that be a conflict? Do we have anything coming up break down or?
So no, that because of the nature of the appointment of this position and then the appointment to the LAFCO commission, and he's an alternate public member. I was looking at that also. And there could be an incompatibility of office issue in terms of, like a public official who holds two incompatible offices or two public offices with overlapping jurisdictions. Like there's the concept of you can't serve two masters. So that happens when, you could be in competition for a contract or competition for state funds or federal funds. It's usually a case-by-case determination, and I haven't evaluated this closely, but because of the nature of this appointment, I don't think there would be an incompatibility issue. Because I don't see any decisions going to LAFCO, for example, in the next year. And then, Mr. Goyen, would have to determine whether he wants to run for election in 26, because that's really when some of the incompatibility of office issues kick in, is when you're an elected official, then when you run for election, that's technically when you would give up the first seat for the second seat. So we wouldn't have an issue here. LASCO would have to determine if they think he has forfeited his seat. And again, when it's an appointed position like this and there's not the significant overlap. I've dealt with that with the healthcare district once in the past, maybe 4 or 5 years. And it was an overlap between a healthcare district and a college district. And in that case, the college had a nursing program with the healthcare district. And there was business sort of between the two. And it was like, you can't be on both boards. And in that case, the matter was referred to the Attorney General, and the Attorney General authorized a quo warranto action and disqualified that person because they didn't want to let go of one seat or the other, and disqualified that person from the second seat. But that's not, we don't have similar facts here. So I don't think there would be an issue as I sit here today.
And just, so it might, as an alternate, I'm not voting.
Yeah.
It's not allowed to be part of the discussion, but I have no voting powers.
I don't know if this is so much of a question. And I think I forgot to ask Mr. Powley, and I don't know how important it is to me or not actually, but since you are a member of District 4, then you would have to wait until 2028 to actually run for the board, because it's 1, 2, 3, and 7 that would be X. So, are you okay with it being like a one-term kind of like?
Yeah, I
So 1 year.
I actually thought a lot about this, and I think in 13 months, I think I can really give a lot of help to the board, as a team player, and after that, that's fine. But I think this next year is going to be very critical for this board to really develop what the future of the healthcare district is going to be. So I think this next 13 months is a good opportunity.
Thank you.
Okay, so that's the end of our candidates. You can take a break.
Yes, I'm gonna call for.
Reconvene at what, 7:36, reconvene at 7:45?
50. First off, I want to thank each and every candidate for taking the time out, being interested in our board, being interested in being a part of the mission that we've been tasked with for AB 918 and creating IVHD into something that was great. So thank you. All right, so I want to thank each and every candidate for coming out and, wanting to be a part of our board and wanting to fill this vacancy and be a part of IVHD. Say this board, it's been something that we've literally built from a piece of paper into what it is today, and we're not quite finished yet. So I appreciate you all putting your application for it. And so we will move into item D, discussion of possible action to appoint director to vacant board position. I'll open up the discussion to my fellow board members. Well, I've read this, so I don't want to talk.
Well, my recommendation would be to deliberate if you have any particular candidate that you have in mind. Anyone can nominate anyone and then see if you get a second, and then you can deliberate, talk about qualifications and whatever you want, or alternative folks. But and then I also want to point out, you don't have to make a decision tonight. You do have 60 days from the date of vacancy to make an appointment. So if you want more time, if you want to deliberate at a future meeting or opportunities to have further meetings with candidates, you can also do that and make a decision at a future board meeting. So I'll just say that.
Well, I mentioned during the break to several board members that I wish we had a golden buzzer here, because every one of you provided some, I heard you speak your resume, and I really, really appreciate the fact that we talked about the diversity that we do have in this room. And I think that's what brings us together, and that's what makes us strong. And from the very beginning, we just gelled really, really well. And I too believe that all the diversity you all bring, I mean, you could very well be sitting right here where we are, and you guys would do well collectively and replace any one of us. But we are at a certain point in time, so here's my spiel. I think that because we are where we are, and the things that we've endured as a group, and the sacrifices and struggles that we've made, I believe that we do need a specific individual with certain characteristics, certain traits and skills. And moreover, courage. I really appreciate Mr. Castro. I don't even care, but it really resonates with me talking about how he supported our IVHD, our momentum, and everything that we've done, and then made a decision to support us, and then potentially it may have impacted him negatively. But I appreciate the fact that he made a decision, and he lived by it, he stuck by it, and he suffered by the sword by it. But so be it. But here he is again, trying to support what we're doing, and I don't know. I believe that everything he said, he understands that he is not going to be running for election. To me, there's something to be said about that. You can look at it in a negative way, but you can also look at it in a positive way, that there is no special interest. There is no conflict of interest of any sort, or even perceived, where sometimes perception is reality. And I believe that for the period of time that he will be with us, he may actually be that one person like us that has no self-interest and is going to be unbiased. And there is no perception of conflicts of interest or anything like that. So I can honestly say right now, I am happy with all of the applicants, but to me, hearing him speak resonates a lot with me, and that would be the person that I would go with.
It's a tough choice, right? When you kind of sit and you sit back and you think, okay, what's on our plate for these next 14 months, right? Like, number one is we close escrow, and like with ECRC, the merges together, and then you get that funding mechanism and all the other chain of events that come with it. So that's kind of what I'm thinking about right now. It's like, that's the goal for the next bit. Which I will be the first to say for the argument.
Yeah, but I do think that he does have an agenda, because he does plan on running for something, because he did say that. So I do think that he does have an agenda. That's fair for the community, so. But yes, he really don't go.
Well, technically, we have a motion on the floor.
Nope. We're just talking.
However this conversation goes, I just want to say I'm extremely impressed with all of you. And like one of my fellow board members said, you all amongst yourselves would be a tremendous board as well. I know several of you, I know the talent in here, I'm really grateful for our county and our district that you all stepped up and put your hat in the ring. And in any which way this turns out tonight or moving forward here, I hope you don't stop with your goal of improving healthcare in the valley also. I think you all have tremendous things to contribute to the community, and our community would be in good hands with any of you. And I just wanted to make that clear out there. I didn't ask any questions. But I really appreciate all of you, and thank you. Really? Well, I'll keep talking now that I warmed up a little bit. So we have different perspectives, right? We have folks, and our board is very diversified, right? We all come from different backgrounds. And really, we have applicants from the medical field, and then we have applicants from the business field. All of which are successful in their own right in all of their ventures and what they've, in their pursuits. And so thinking about that as to how would that apply to our district, right? And so something to consider, right?
I would say my worries with the medical professional staff is the differentiate between a board member who is here to do governance and, being a staff member. I'm gonna be frank, I think the reason these hospitals are in those positions, which have board members stepping into operations, so that's my biggest fear. Which I would say we're addressing in our bylaws committee. But yeah, understanding eyes in, hands out approach, so if you're not in the operations, you're not the one making the phone calls or doing the paperwork to get the child done, you're not the ones, telling the CEO directly what to do, that comes collectively as a board. You're there to support the CEO, provide direction, collectively as a board. And if you have a board member that kind of really strays off of that, like per se, like you can do a whole lot of damage. And I think the situation these hospitals are in is a lot of that damage has been done.
So I'd like to hear from the other board members. What the thoughts are, if not, do we need a decision on what the board and vote on this or not?
I'd just like to say that I don't remember you all. You have to community and we have appreciated that you consider yourself. Well, everybody's very good to you. Many of the board members consider that you want to become more. It's excellent. It makes it very difficult to.
I guess I'm gonna say ditto, because I do believe that you're all very strong candidates and you have made it a very difficult decision. And there are a couple of things that I do want to weigh in on and that I do agree with Katie. I feel like having the medical profession side of it is just too messy for me and this board and how things have been. And we have some very strong candidates. And I know Mr. Castro was in it for just a year. And Mr. Gregorian, he's basically not in a district where he can run coming up in the next election. And Mr. Cowie, I don't think we asked you if you were going to be running or not. But I think in my mind, and I almost hate to say this because I did say full disclosure, I've known Felipe my whole life, but I'm not saying this because I've known him my whole life. It's because I know that he's good at what he does and I think he can bring value to the board. But it also makes it, I'm just going back to things I've heard from the city council and different things when appointments come up, that he's kind of the choice that he's in it for these 13 months and then he's out. He has to wait 2 years to run. So if we choose him, we're not giving any of the other candidates a leg up. So should they choose to run in 2026, which sounds kind of, I don't know how that sounds. But I know that when city councils, I've seen them do this where they have to appoint, to fill in terms. They kind of go for the person that can do the job, fill in, and then leave the rest of the group to elect. So I guess I'm leaning towards Felipe because I think he would be an excellent addition to the board and he's definitely going to be short term, but I mean, all of you are here saying that, and this is a very tough decision. It really is. And that, have to make it out in the public, it's like kind of brutal, awkward. Because I don't want anybody to have any hard feelings because, like I said, any one of you would be amazing. So,
Just,
I agree with you. Everyone would be qualified for this position. I agree with you. We can get the classrooms. That's the. There was a time for 3 months. And we do have the things like that. That's the next of the family.
I do though want to throw out that, because earlier you said about Mr. Castro that he has an agenda, because he said he might not want to run again, but Mr. Aragoyan also just ran for county board of supervisor. And, potentially could run again, so I mean, really throw that out there as well. I didn't know that.
So I don't see it as a bad thing, people wanting to run. And the reason I say that is because myself, I knew this was gonna be an appointed position. Initially I thought it was just gonna be a year and a half or something like that. And then it turned out to be a year.
Bye.
But whether an individual chooses to run or not, or in an office, I believe that that's a personal choice, not a choice that we need to take away from the individual. The reason I brought up the fact that he's not running is because it's based on what he said. And knowing that I was only in it to be the appointed person and not run. At the end of the day, though, it's still a choice that I would probably make in the last hour if I needed to, but I don't believe he is gonna run for this board. So I just value, like I said earlier, the fact that he's just gonna be in there to work. I do also agree with Enola, with Mr. Irigoyen, that, I mean, everything I've heard about him, I don't know him personally, is that he has an outstanding work ethic. And so does everybody else to be in it for such a long time. But yeah, I don't, if somebody has aspirations to potentially change their mind about running for something, I'm no one to
I see somebody interested in running for our seat in the future or any other seat as their desire to have an impact in our community in one way or another. So, yeah, so I'm on the same line as far as that wouldn't be a negative necessarily. And I'm on the same page as far as Mr. Castro, Mr. What's your name, man? Felipe. Felipe. And I happen to know Matt a little more than anybody else, really, Matt County. I had the privilege of serving on the board of realtors while he was president. And so I did get a feel for his leadership and his ability. And I've seen most of his career, I guess, witnessed it, as a fellow realtor, fellow broker now. It really, Matt sets the bar very high. And he's always, you will never find anybody who could say anything negative about Matt's abilities or his character or anything, quite frankly. And so just wanted to put that out there, just because I know it. So I just wanted to say it. But yeah, this is a tough decision, man. Really a tough, and don't want to leave Carlos out either. I mean, your resume is amazing. You've done a lot. And I've gotten a chance to get to know you a little bit as well through Rotary, what have you. It's all been good, it's been very impressed with you and your family and everything. And so here we are.
The embarrassment of riches.
It really
I've been
is.
part of lead council for boards where there were only one candidate and the one candidate was not impressive. And then they're in the awkward position of having to say, let's try to get more candidates. Good position to be in.
I think they're all excellent. That's why.
And I can agree with what everyone has said, as far as the platform is going, and I think for me, in my opinion, that the top team candidates, what I would consider.
Yeah. I mean, it's hard, like, I mean, even back to, I think that's a great candidate, you can tell he's cares about his community, to help, healthcare is not about politics, healthcare is about, serving your community and building a system that's, better and, well past our lifetime, right? So, but again, like I bring it back to the goals, or what's our goals for these next 14 months, right? And what potential board member do we first see is going to be the most beneficial to help guide us and be a part of our team moving forward. So. I mean,
Yeah, really, not to take away from we're all here because of the medical field, right? And so, but when you put it that way, as far as what lays ahead of us, it's the structuring, it's the creation of our district and moving that forward. And so who brings those skills, adds to those skills, and adds to our attributes and can help us move forward with that.
Okay. The bond issue is. Okay.
That's gonna be huge. Ramon wasn't not
And that's
informed
not
about it.
necessarily, I'm sorry. Um, I just wanted to say, let's not forget that, we do have the bond issue, the funding mechanism, which, that's why I guess I'm leaning more towards the business background, because you all know that if there's any way possible for us to bring these two hospitals together and make enough money to make the pain not so bad in the whole tax realm, I am all for that. So that's why I lean more towards the business building blocks, I guess you would say, to try and get us through this. Because right now, to me, the big issue is the financial. That is, I mean, Mr. Castro was correct, and that is the next thing. I mean, I have every confidence in Pablo and Chris and UCSD in the operations, merging the two hospitals, and they have caught our vision of making sure that we are servicing people, that we care about patient care so that we're getting people here to stay. But right now, we need that help in these next 14 months, 13 months with the financial side, and how do we get the finances, the funding mechanism, meet that deadline, because our deadline is November 26th to get the funding mechanism in place. So I guess that's why I kind of lean towards, going with them.
Does anyone want to make a motion? A particular individual?
Okay, I will launch out there because I think we have excellent candidates. I don't think we need to table it. I don't think we need to do any more anything. So if I'm understanding this correctly, I need to make the motion
To appoint.
to appoint Mr. Irigoyen, subject to,
Subject to attestation of qualification. It's just a form you're gonna have to attest that you're a registered voter in the county of Imperial. And that's it. And then we'll have to swear this individual in, they'll have to accept and then swear them in at the next board,
I guess, that's,
subject to attestation of qualification.
I'll second it.
Perfect. So I have a motion by Good Sound, a second by Proctor. Can we do a roll call, please? Voters?
Director Pymore,
Yes.
Director Goodson,
yeah,
Director Garcia,
Yes.
Director Hoffman,
Yes.
Director Lurker,
Yes.
Director Lopez.
Yes.
Congratulations, Mr. Line.
Guys.
And thank you to everybody.
Thank you, guys. Very nice.
Malcolm.
Yes, and I just want, I know Matt, I know you with the realtors and everything, and it has been really hard, but I hope you do run. I really do.
Here's the panel that I think the answer to your question that you kept asking, I was here for that.
Thank you. Thank all of you. Like I said, you're, any one of you would have been awesome.
Thank you. No. The stop is with side sport.
Thank you, Davis.
Thank you so much.
Commissioner?
Thank you.
Thank you, David. Square the ball. Thanks.
Yeah, I'll be in touch with you.
Okay.
I'll be in touch.
And you will start.
It's hard.
So hard.
They're all staring at you.
I'm so glad I'm not.
I would say I do appreciate the loans, like, I'm just gonna sit outside, I'm not worrying, this is a stuff thing, and I'm like, I wish they all were.
Why don't you tell them about their mistake? I want to commend the board for, it's very hard to keep this publicly in front of all the time. And I think outstanding job.
Yeah.
Your determination, we're solely looking out for the best interest of the district. It's admirable. So,
Big kudos. It's really hard to do.
Yeah, good job, Laura, you're the one that did all the good.
She's asking the hard questions and everything.
All right. Good job, Laura, one more hard thing to do. I'm saying,
Yeah.
yes. And I mean, I just commend our board all the time, like, from the beginning, we've done so many hard things, and I don't think I've ever worked with board this hard, like, I get like teary eyed, like choked up, thinking like, from the beginning, like, 89 a day was a piece of paper like this, right, and now, look where we're at, you know, and it's because we all work well together, so I'm truly grateful for each and every one of you.
Likewise, your leadership is well good.
After attending the IVHD conference and seeing some of this section, I have to say that I love all of you. I think we do, I mean, I know, we don't always agree, but we always respect and we come to consensus and we support, and that is a win for healthcare in the Eternal Valley. So it is an honor and a privilege to be there.
Say, good night, is maybe all of us.
I know.
So, we're gonna go to items for future agenda.
So I want to throw this out there real quick, just to put it in the ear of you guys and see if you want to make some changes, because coming up, we have some big meetings that are going to happen. One in particular is the one that's scheduled for the 13th, which is the presentation by PMA for the master planning. And it's going to be about the stuff for pioneers. With that meeting is actually scheduled to be in Calexico, and it might be a better idea to have it scheduled in Pioneers, considering the circumstances surrounding that. So I wanted to put that out there first of all, for the board's consideration to maybe change the 13th and the 11th.
I'm just asking, so it's not November 13th?
Yes.
Okay.
So they'll be there to present that on November 13th. On the 23rd, they'll come out again. If you guys remember, they'll do the stuff about the NPC, SPC, give you the rundown of what all of that is about and what that looks like on the 23rd
October.
of October. Yep. The other thing for consideration is that we would wanted to ask the board and see if you guys wanted to do this is at the next board meeting on the 9th. So we have gone through the processes of narrowing it down for PMA and the master planning to one that would come to you guys. There is a chance if you guys wanted to do that on this next board meeting where we could give you a sneak peek, if you will, and that kind of shows you what that's about. It won't have the pricing done by that point in time. We have some ideas on what that pricing would look like, but at least it would give you an opportunity to kind of see some of it before it gets all done. And then if there is something that maybe we missed, going through that process with all the staff and everybody, you could look at that and see at that point in time, but it's an opportunity to be able to get a sneak peek, if you will, that we would present out to the board just so you could see it.
For starters, I will not be here on the 9th. I have a conference for Stephen Imperial. I would say my only worry is if we put options out to the public with a price tag and we say, this is gonna cost us $50 million. And then we get a curveball and we're like, just kidding, it's $150 million. Like,
We wouldn't put the price because they'll have to do that. That'll be the part of the presentation that comes on in November. Okay.
I mean, yeah. I want, like, I mean, I think I can wonder on everybody in the sport, we want the most cost effective way that the med staff's happy with because we're not working, right? Like the most. Most of the field is that stuff.
Yeah, absolutely.
All those team are happy with.
We just wanted to put it out there for an opportunity. If you wanted to, you have it. If not, it's not a big deal. Yeah.
And it would make sense if we're spending so much money and rent for the facility that it's.
Crash.
Awful.
It was awful.
I'll be the first one to say it.
Yeah, also that we at least incorporate that into that master site plan. With the understanding that obviously we would finance that with what they're paying.
Yep.
Terminated for that plan that wasn't done. And you post the hospital a nursing home that you're proud of, that you know you will provide the services that it needs to serve.
And there's a point now, over one thing higher, that people don't feel good about being here at the end of the day. I say you press me, and if we can create an environment too, if we're along those lines, if we can create an environment where people don't feel like, oh, geez, this is what it's come to.
The reason why I bring that up is because the seismic work is one thing, but I think we would be missing an opportunity if we were not that. I guess it's not important.
Oh, yeah, and there's so much room for growth. We filled out these, this, populous accounts in general, because both of the ones that we currently have are very big.
And the number of beds we have compared to our population is much lower here than most anywhere else.
And strategically, you want to.
Yes, yeah.
Yep. This thing, nobody else comes in here. Set up shop.
I mean, I will be the first one to always say this, I hate paying rent and making somebody else money would pay less than it's either some. So, Yeah, no, I like it. I mean, and who's a director that's has the most experience dealing with this, or what ones are there, so.
And I will agree that we need to step it up here. Along or off.
You're off.
I'm off. Am I on? Yeah. And because I will say I agree with Enola, and the other piece that we need desperately is the rehab piece, the physical therapy piece. Because there is a huge difference between what's happening here and what's happening in San Diego. And there's a definite need, and if we can get that piece of the puzzle, if we can get a better, I mean, a place, I mean, it needs.
Well, there's really a lack of physical therapy here, you know.
Well, I think the infrastructure and the nursing home that we have created for.
No, the gym is terrible there.
Well, I mean, this is something I think Chris has talked about for a long time, is potentially building that, just because the rent is astronomical. I mean, and this is kind of how I see it too. That skilled nursing home is supporting that hospital. Let's be real, like, you look at the finances, and it's all we're, I understand, like, we gotta live in the hospital, but like, you're literally taking all this money that those patients in there are bringing to the hospital, and the place that they're getting care in, I'm sorry, it's crap. I would not put my mom in there. I would not put somebody that I don't like in there. It's awful, you know, so I think that's one of our goals we should have, so, you know, it's great to bring back. And I disagree with you, I always felt that way, when you want to invest in in the law. We're not investing in.
And there's opportunity there to increase the bed size that we have, because again, we have a need there.
I feel like our patient census too, on that, it's kind of, you know, so that's all. No, you're fine. I would just say our patient census, compared to what it should be, is pretty low, and I think that has to do with people transferring out, like.
It's not even that, it's the building itself has issues. So for example, just so that you guys are aware, to give you a rundown, as we've tried to replace the air conditioners in there, the HVAC system from the time of the fire, it's been very problematic. They finally got to the point where they started the process on it, which means they pulled the other ones out, which means they had big old holes in their ceiling, and then it rained this last couple of weeks. And so we have a number of rooms that we can't use, and we are the only, as far as I know, we are the only skilled nursing facility in the entire state that has rooms of 6 or more people in there. Like, it's just unheard of to have that anymore. And so like, when you take one of those rooms out, that means there's 6 to 8 beds that we can't fill until those things get fixed. And so like, that whole process and the issues that we've had with that building have had a negative impact on what we're able to do. To your point, there are some people that do actually leave because of that, but other people don't have that ability to do that. And so they're there, or they want to be able to come there because they want to stay close so family can come there, but they can't because we don't have the rooms available because of the issues that we have with the building itself. And when I tell you, like, and for those who don't know, because I know some of you are aware because of conversations we've had before, but we pay $132,400 a month for that building. It's the skilled nursing. It's over on Cattle Call. Yeah, it is yeah, exactly. And that's why we're saying that we can literally pay for a new building paying that much. And it'd be a much better situation for everybody all the way around. And we can increase the number of beds in it as well. So, yeah. And that's one thing that has just for those who haven't been involved with this through the whole process as well. I'll hats off to Jonathan. He has been the longest tenured executive director that we've had there since this whole thing has started. And since that has happened, we've actually been able to stabilize the staff. And to get to that point, some of you guys are aware, it has been, it was a terrible process. Also, as just for note, he did pass his state boards on that, so he is now officially licensed as in the state of California, which is very positive for us as well. But there's a lot that's gone into that. And the folks that work there, most of them now, like we had some people we really had to work with and they're no longer there. But most of the folks that work there now, like they're there for the right reasons. And as much as it has been to make sure that the patients and the residents there are taken care of, the new building will also help take care of the staff from that perspective, because right now, just even from ergonomic standpoints and the other issues that we have there, they struggle with some of that. And they did, like, my hat's off to those guys, because they had to go through the summer without working air conditioners. Like, we had to put giant air conditioners around in some places. And the standard for a nursing home is the nursing home has to be between 71 and 81 degrees at all times. We were up at the 79, 80 degrees. And if you do the type of things that those nurses, CNAs do in particular, at 80 degrees, it's awful. And they did it. And they did it. And they do it because they love what they do. They love those residents that they have there. And we've got a good group there. And I think this would also speak volumes to that as well. And helping them, because we do have had that issue of trying to bring them over because they're the newbies, right, into this whole group. We purchased them. And so, like, that's been an issue too. They don't feel like they're truly part of it. It's much better now than it was. But I think that would go even further.
So we're not gonna have that item on the agenda. So no facilities item from October 9th, sounds like.
As far as, yeah, no sneak preview stuff, yep.
I do have two quick things. One, there is gonna be a closed session on the next agenda for another consent item for a beta settlement. And at the last board meeting, we discussed bringing a rundown of all outstanding litigation. Do you still want that to happen?
You did that at the.
Oh, yeah, that's what I was,
I'm
that's
just
what I
being
was.
selfish, but if you guys want to, that would be.
So I'll just put the one that we need to the timing, we need the consent. And you already actually know about that one, so I told you about it. So I'll wait until the 23rd to do the rundown of all the other outstanding litigation, just so that we do a recap of the summary of where we're at, how many open lawsuits you have, et cetera. Okay. Great. Do I have any meetings?
Well, do we want to make those changes to the placing on that so that we can post it? Because I want to be able to tell like, for example, if we're going to move the meeting in November to Pioneers.
It's gonna be in finance. I mean, that's.
It's up to you. Yeah, I'm just throwing that out there from the standpoint of, it's like it's for their building kind of thing. You might have more people or something that we come there, but it can be anywhere, obviously. I just want to throw that out there. I don't think with what we'll have to do in the layout and potentially the number of people that will show up, I don't think Calexico would be a good spot to do it, is what it comes down to.
This is for November 13th.
Yes.
So why don't we put an agenda item on the October 9 agenda to revision to regular board meeting location? Because we should probably agenda it, just because this is something that the board approved, so we should have an agenda item for it on the 9th.
Some of the staff, I know they see.
Most of them have, yeah, some of them have, not all of them, but.
Yeah, my thing is, can we make sure we get like something to set up, like when it's on the projector, like I can't see. I know, and then. Yeah, well, that's my biggest thing is like the displays there, it's really hard to see. But.
I'll see what I can do to make that a better setup if that's where we want to move it.
Yeah. TVs are cheap.
And there's ways to do that, so I'll work with IT to see what we can do. We'll look at some options.
All right, well, do you have anything else?
There's one other thing I'd like to just bring up, because I had a conversation with Katie and I talked to Pablo about this as well. So the Becker's conference, where I was asked to speak, I would like to be able to fulfill that assignment. We do, like, the hotel has already been paid for and it's non-refundable. The only expense to us would be the flight out there. Because I'm not pay for any of the rest of that stuff. I talked to Pavel about it. He's good with it. I would like to reintroduce that to the board to see if you guys are okay with keeping that commitment. And then obviously, if things change between now and then as well, and something happens, more than happy to like tell them, hey, sorry, I have to step out because we have other things going on here that I have to do that for. But if not, then I would like to fulfill that obligation if the board's okay with that. It's the first week of November, like Monday through Thursday.
Chris, correction, this is something that would be appropriate for a closed session for a CEO performance evaluation, but, you can give. You got it.
All right, thank you guys. One more. No.
No.